Today, we look at how many people are dealing with mental health issues by turning to cigarettes. Many smokers say anecdotally that smoking improves their mental health. Studies say the immediate effects of nicotine contribute to an improvement in mood and concentration. But nicotine withdrawal leads to irritability, anxiety, and depression. We're going to discuss the issues surrounding this now with Dr Matt Thompson, consultant psychiatrist, and Jeff Crowther, clinical lead at Bosence Drug and Alcohol Treatment Centre. Good afternoon to you both.
Hello.
So it's incredibly difficult, this issue, isn't it?
Yeah, I wanted to get a little extra comments on e-cigarettes. I often listen to this lunchtime show, and Lawrence has a habit of saying, "Oh, e-cigarettes, no one knows how bad they really are for you." And the answer is, we know that they're much, much, much better than tobacco. It's difficult for anyone to be brave enough to say that because there's no proper regulation of e-cigarettes, and because it's not regulated, no one can make official recommendations. The only companies that are seeking licenses from the MHRA that regulate medical products are tobacco companies, and then there's a conflict between the medical profession and tobacco. But in a typical year, a third of smokers try and stop. They're much more likely to stop with nicotine support, like nicotine replacement therapy, and at least brief advice or a stop smoking service. And actually there's research that shows people who get on with e-cigarettes, because lots of people don't, use them very effectively to stop smoking.
And I'm guessing as well with e-cigarettes, there's more than one way to skin a cat, isn't there? And okay, you know, nicotine gum was all the rage for a while, and some people were saying, yes, but you've still got your nicotine habit. It's just another approach, another thing which might work for somebody.
There are some concerns about e-cigarettes, like what about people who've never smoked tobacco starting to use e-cigarettes and causing harm that way?
Rooty, tooty, fruity flavours that might appeal to youngsters.
But the number of people who do that is tiny. And there's also the concerns that people who have given up smoking then start e-cigarettes. And again, the numbers are small. There are actually three groups of people. There are people who like vaping and never plan to stop using e-cigarettes. There are people who do it for their health, for the smell, and to save money with the goal of stopping, like we heard from Neil. That was a fantastic case study. Thanks very much, Neil. So people trying to stop. He didn't have a date, but he's got a plan. And there are other people who sometimes use e-cigarettes, but they're a bit ambivalent about it and want to stop it all, but can't quite get round to it.
And when people are, you know, using e-cigarettes, it comes in different strengths, doesn't it? So I'm guessing people can reduce the amount of nicotine that they're taking from these things.
Yes, and that's when it's worth widening this argument back to addiction generally. Liberty mentioned caffeine. Caffeine's addictive. The less coffee you drink, the more potent each coffee you have is. We talked about painkillers. The less you use painkillers, the more powerful each painkiller you take is. Once you've got an addiction, a lot of what you're doing is getting your blood levels back to where you're not in withdrawal.
Okay, and that goes throughout the substances, because you do hear, don't you, with people with drugs taking more and more and more to get the same effect. We know we all used to be said, I mean, it wouldn't be appropriate in this context, but so-and-so's a lightweight because they have one half a beer and they go giggly because their bodies aren't habituated to the substance.
Yeah, absolutely right.
So really that's a key point, isn't it? When you find yourself having to up your dosage of whatever.
The other message about e-cigarettes is people smoke tobacco for the nicotine, but they die from the tar. So if you manage to get just onto nicotine, to get it into your body in a less harmful way, and the estimates are up to 100 times less harmful for you, even if it's 20 times less harmful for you, that's still a good thing. You're getting the nicotine, but you've got rid of the tar. The tar is going to cause a long, slow death and take 10 years off your life compared with non-smokers. So you've still got a nicotine problem, and then it's up to you whether you address that as an addiction, like cutting down the amount of caffeine you use.
Is the fact that an e-cigarette has the same, it is, you hold it in your hand, you put it in your mouth and you suck. Is that why many people find it helps them get off cigarettes because it's the same physical action, or is that nonsense?
I don't think it's nonsense. I just wouldn't like to comment on how that's working. But one of the risks of banning e-cigarettes in buildings is then if somebody wants to vape, they go and hang out with smokers and might relapse back to the tobacco that they're trying to give up.
One of yours.
And the difference between an e-cigarette and tobacco is it's much slower. Despite increasing the concentration, increasing the voltage and the strength of the batteries and improving the technology, which is what the manufacturers of those products are doing, it takes about an hour to get your peak plasma level, whereas a cigarette can do it in a minute.
Okay, so in other words, if people nip out and just have a quick
if you want a quick hit of nicotine, it'll be much quicker with tobacco. So as well as people, not liking the flavours or getting a sore throat, there are reasons why people don't like e-cigarettes, but the health benefits are definitely there.
Gentlemen, thank you both very much indeed for coming in to see us.